Let's talk about regenerative medicine. Regenerative medicine stimulates our bodies to rejuvenate, simply stated. And I want to talk about three things: PRP, PRF, and exosomes. And the difference in those is that PRP and PRF comes from the patient's own blood. So we do a simple blood draw, spin it down, separate out the growth factors that are found in the plasma or the golden part, and then administer that to the patient. We can inject it into the scalp for hair growth, microneedle it into the skin, or apply it to the surface of the skin when we're doing collagen induction therapy treatments. We can inject it into the breast for breast rejuvenation, vaginal area and penile area for intimate rejuvenation. So the difference in PRP and PRF is that PRP, we do a simple blood draw, spin it down, separate out the growth factors, so red blood cells sink to the bottom. We have the plasma at the top. We use a simple centrifuge to spin those tubes down. So the PRP does have an anticoagulant in it, and when we use the growth factors and stem cells, they are released over about a 4-hour period of time. With PRF, it does not have an anticoagulant in it, and that fibrin matrix is allowed to form, and that's a scaffolding for those growth factors and stem cells to be released over about a week's time. I prefer to use PRF in the form of a gel for injecting in the tear trough areas. And so what we do is we spin it down, separate out the golden part or the plasma. Half of it goes into a chiller, half of it goes into a warmer, and after 11 minutes we mix the two and actually create dermal filler made out of the patient's own growth factors. And so when injected into the tear trough area or other areas, you actually do get a fill. And then over time, those growth factors and stem cell stimulate growth of the underlying soft tissue and also rejuvenation of the skin. Now, exosomes are made from fat cells. And what exosomes are what our stem cells use to communicate with other cells. So if you cut your arm, stem cells rush to the area, they release exosomes, and those exosomes communicate with other cells to come to the area and make new skin. So when we're doing collagen induction therapy treatments, where we're creating little channels down into the dermis, we apply the exosomes to the surface. They penetrate down those little channels and call upon other cells to rush to the area. And number one, it's very calming after the treatment. Number two, it helps you recover from your treatment more rapidly. And number three, you just get greater results. So come see us at Radiance to learn more about how regenerative medicine can help you. 281-367-4700.